Okay, and good afternoon. Thank you so much for your patience. We were having a little bit of technical difficulties there, but we are live for our daily update. This is Friday, April 17th. My name is Vivian Uccello. I'm the Public Information Officer for Riley County, normally the City of Manhattan. Today we have with us Local Health Officer Julie Gibbs, as well as Riley County Emergency Manager Pat Collins, and Assistant Director of the Riley County Police Department, Kurt Muldrup. Thank you all for joining us today. We will start with a statement from Julie Gibbs. What are our numbers today, Julie?
All right, thanks, Vivian. Hi, everyone. As of today, Kansas has 1,705 positive statewide. That's up by 117 from yesterday. Kansas also has reported 375 hospitalizations and now 84 deaths. Riley County now has 27 confirmed positives, up 1 from yesterday, and 12 of those have recovered. We have 0 hospitalizations. The most recent patient who tested positive is a 45-year-old male who is currently recovering in isolation at his home. This patient can be directly linked to a previous positive Riley County patient. The Riley County Health Department has been in daily contact to monitor his condition. We are currently monitoring 32 other individuals, and we have 22 tests pending. To this date, we have had 178 negative tests in the county. Please remember that you can and should still access healthcare when you need it. We are hearing from some individuals that they are either nervous to get out for healthcare or they don't think that they should. If you have a life-threatening situation, you need to call 911. If you are sick, you can still see your healthcare provider. If you have symptoms such as a fever over 100, a cough, or shortness of breath, please call our screening line at 785-323-6400. We do have healthcare professionals that answer those calls daily from 8 a.m. until 10 p.m. And that number is 785-323-6400. We are still encouraging anyone with questions to please email us at rileycountycovid19@gmail.com. Please continue to stay home unless you need essentials. Remember that getting together with friends, having parties at your house, or even visiting relatives are not recommended at this time. Let's keep up the great work that we've accomplished this far. We will make sure to do what we can to keep you safe and informed. So please do your part by staying well. Thank you. Pat?
Thanks, Julie. I wanted to talk a little bit about preparedness. We talk all the time about trying to come up with a plan, trying to be prepared. And I know listening to the professionals out there, we're talking about at least 2 weeks yet before some kind of a peak on this. So we could still be preparing for those type of items. And any person out there could be adversely affected by this. So I wanted to talk a little bit about some severe weather concerns and how it actually plays into what we're talking about preparedness for this type of an event or any type of event. When you're looking at tornado preparedness, we always talk about have a plan, have a place, have a kit, those type of things. So there is a kit that's out there. The ready.gov website for FEMA is a really good place, and it's got a list of some things on it. And I wanted to talk a little bit about those because you don't think about those if you're not affected, and I know a lot of people think, well, I don't go out. I only go to the grocery store. There is a chance that you could be affected. So you need to think about what are you going to do if you are adversely affected by this virus? Well, you need to have a regimen of your prescription drugs. You need to have a regimen of non-prescription drugs that you normally take, aspirin, antacids, those type of things that the pain relievers you might normally use on a regular basis or need. Need to talk a little bit about cough medicines, cold medicines, things like that. Need to look at other people around you. What happens if you are the person that is quarantined and you can't have other people around. What happens to pets? So you need to talk to your veterinarian and find out what's the best thing to do with your pets, how to keep them, if there's a place to keep them, maybe even come up with a buddy system. So if you are affected, somebody else takes care of your pets, or if your neighbor is, then maybe you take care of their pets. So there's a lot of things out there that we need to think about. And I know Julie's been talking a lot about this is how you keep away from this, but what I'd like to kind of remind you is that you need to be prepared just in case you or one of your family is one of those that is ill affected.
Thanks, Pat. And I know this is something, you know, we've talked about in my household, and I've looked at kind of the CDC website. What do you do if you do test positive, if you do come down with the illness? Kind of how do you take care of yourself? How do you take care of members of your family? So I'll be sure to share that link to the CDC information in the comments. Julie, do you have some general advice about how to care for someone or care for yourself if you do have symptoms of the virus?
Sure. If you're in a household where there are other people, the one thing that we really want to make sure is that you stay away from them as much as possible. Wear a mask when you are around them, but really just trying to stay away from other people as much as possible, so you reduce that risk of them also being exposed. Also, with that comes try to make space for your own room. If you have your own bathroom, that would be the best. If that's not possible, just make sure that you're really disinfecting those surfaces. Make sure that you have what you need. We do live in a day and time now where we can get what we need pretty quickly as far as food and necessities. So make sure that you can get those things, or call a friend if you do need some help getting those things. They can always deliver those things to you and just leave them on the front porch. But make sure that you're coming up with that list of things that you need, and you have access to those things.
And thank you for that. We all have kind of some idea of what the disease looks like. We've been watching the news. We know to look for those warning signs of temperature over, what is it, 100.4, shortness of breath, and cough. In terms of recovery, do you have any data or expectations we can set for people about kind of the severity of the illness, what that might look like for them?
Here in Riley County, we've been pretty lucky so far. We haven't had many people that have been hospitalized, and really symptoms have been pretty mild. Of course, it depends on the person. If you have underlying health conditions, we usually see some symptoms might be a little bit more severe. That's when we usually see needing hospitalized, depending on, of course, that and possibly your age. But really, we've seen, I think our average age right now is 39. And so we've seen a younger population with this. And so very mild symptoms, fever, cough, shortness of breath, those are the things that we generally are seeing. But toward the end, we're also seeing some loss of taste or loss of smell along with that. That's a good indication, especially if you've been around somebody who's been tested positive. That could be a good indication that you need to get tested as well.
Okay, thank you. Shifting back a little bit to this idea of emergency preparedness, I know we've kind of seen on the news there have been some record-breaking tornadoes in the country. You know, Mississippi had a 2-mile wide tornado recently, and that's, as we're thinking about this kind of global threat, as residents of Kansas, we still need to be aware of the threat of severe weather. And Pat, I know you talked about the other day, but I'd like you to kind of repeat that information. You know, if you do need to seek shelter, what's your advice for people who might, we are still afraid of being exposed to the coronavirus. Can you talk a little bit about that?
Well, let me start off with the first thing you need to do is be aware that you could have severe weather coming in. I know there's a lot of people say, well, I didn't even realize that it was going to storm that day, so if you check the weather this time of year, you start seeing clouds build up, start that preparedness, get some kind of idea, situational awareness. The other thing is, don't wait for the sirens. There a lot of times people say, well, I'm going to wait for the siren. Well, there's a multitude of ways to get notified of the pending disaster. So go to the Weather Service has one. We have our Everbridge notification system. All the radio stations, TV stations. I mean, they've all have some way of being notified, and I wouldn't count on any one way to do that. You need multiple ways to get notified. And then if you do get notified to take shelter, do that. Don't go outside. Don't take videos of this, go in, take shelter. And if you don't have shelter, plan ahead for shelter, or go to a common shelter, try to find somebody's house that you can go into, get a sturdy room in the middle and the lowest floor, and protect yourself until the warning is over. And then we don't do an all clear siren. There's no such thing as an all clear siren. If the siren goes off again, stay in shelter. That means there's the warning continues. The only way we do some kind of an all clear is we call the TV stations and radio stations to let them know that the warning's expired.
We've talked also, kind of used the term the most immediate threat. So we're all aware that there is a health threat. We don't want to come into contact with people if we can avoid it. But in situations where group shelter is your only option, when there's severe weather, we are kind of giving people the advice that you address the most immediate threat, which is the severe weather, the impending storm. Also in relation to kind of other health concerns, or if something were to happen, you fall and break your leg. We've talked about the fact that the emergency room is still open, urgent care centers are still open, doctors' offices. AD Muldrup, can you talk a little bit about 911 services during the pandemic, and
Sure.
During
any emergency, obviously we want you to use 911 to get immediate assistance, whether that be with fire, EMS, or police. But also understand that during especially a sudden emergency like a tornado, those systems can be pretty overrun. So only use that if you really have an emergency. You can dial the administrative line 785-537-2112. And that'll still get you the police department. That'll still get you a call taker, someone that can send assistance. But obviously 911 would be the desired method if it's an emergency. Don't use 911 for questions about what's going on, et cetera. That should be the administrative line.
Okay, thank you very much. Shifting gears here a little bit, we've had some questions come in about testing capabilities, testing capacity, who gets tested for COVID-19. We've talked about it some, but are there any new developments or any new availabilities?
Right. Well, we're still following the same guidelines that we have, are pretty close to the same guidelines. So because we are limited with our testing supplies right now, and we're really wanting to conserve those for individuals who are symptomatic. There is information coming down from the state. I actually just listened to Dr. Lee Norman, governor, on their conference call earlier, their press conference earlier today, talking about the 3D printing of the swabs and how that's looking for us. As far as Riley County, I don't think that we're going to see that soon, just because they're going to get those out to the communities that really need them, that are seeing high numbers of positives. But maybe within the next couple of weeks, we might see something like that. But as of right now, we still have to stick with the same guidelines as far as who we can see to get tested. So just to reiterate that, how that flow goes is to call the screening line first. If you have symptoms such as fever, cough, shortness of breath, call that 323-6400 number. You'll be assessed by a healthcare professional. And if they determine that you need to call your primary care provider, you'll be further evaluated by them. And they might determine that you do need to come in to get tested or go through our swabbing line to get tested. And we do have that up every afternoon. And usually the turnaround time for that is around 2 to 4 days to get your test results back.
Okay, and do you, are people advised to stay in quarantine if they have symptoms? Is that part of the advice?
Yes, absolutely. If you have symptoms, we want you to stay away from people, stay at home, stay quarantined. And especially if you get tested, you'll be directed to stay isolated until you get those test results back.
Okay. We've also been kind of celebrating the numbers of people recovered in Riley County. We have 12 people who have been considered recovered from the disease. Can you talk a little bit more about what recovery means?
Sure. So according to KDHE guidelines, that is 7 days, at least 7 days from the onset of symptoms. That's the minimum. And you also have to be 3 days fever-free without the use of fever-reducing meds. Also, we want to see a decline in your other symptoms, or those other symptoms are gone as well. So that's why we monitor these individuals daily, and we ask about their symptoms daily, because we want to keep monitoring for those. And when they are recovered, when they meet those criteria, then we can send them a letter letting them know that they are recovered.
Okay, very good. We've heard some stories about scams coming in from other locations. People receiving a text message that says, you've come into contact with somebody, click this link for more information. Can you talk about maybe AD Muldrup, talk about those circumstances?
Yeah, it's even without the pandemic, we should always be cautious about the various scams, but we know that during these times, people are going to try and prey on the vulnerability, the concerns that people have about their health and about the stimulus checks, et cetera. So first, as far as contact tracing goes, anytime the health department or a police officer with the police department calls and asks information about that, that's what they're going to be doing. They're going to be calling you. You'll be able to tell that it comes from the health department or the police department. You won't be getting a text from anyone asking you to click on a link and provide information. You'll get an actual phone call, and you can always, again, call the police department or the health department back to confirm that that's who it is you're talking about. As far as the contact tracing, there will be some personal questions, but it'll obviously be related to the medical condition, but it won't be asking for information, bank account information, social security number, things like that. That information will not be requested. So you should never be giving any of that over the phone, even if we are the ones asking it. You should still be cautious. And then other scams, just again, are financial for your stimulus check. Same thing. Someone's going to call, tell you that you need to provide this information, your bank account, so it can go in. Everyone should know that's not how it's going to happen. You'll either receive an automatic deposit, and I believe that's the only way you're going to get it is an automatic deposit. But you won't have to do anything to receive it or give any information to receive it. Always question those things.
In terms of that, I believe if you are not set up for automatic deposit, you will get mailed a check. So there should never be a circumstance where somebody is calling or texting asking for your financial information. And again, if you suspect that the person contacting you is not from the health department, it is perfectly fine to hang up and contact either the health department or the police department. You will not, you won't be in trouble. There will be no penalty for saying, I don't want to talk to you about that. I'm going to call back and make sure that this is legitimate. So we encourage people to do that if they have any sort of doubt. I'm going to check the Facebook page real quick to see if we have any additional questions that have come in. Actually, there's one that's asking about false negatives on tests. Is it possible that someone who has been swabbed through the swabbing station or their doctor's office has come in negative, that they would be tested again?
Could be a possibility, yes. We haven't had this case here yet to where we've needed to do that, but yes, that could always be a possibility, especially if you keep having symptoms, and that would of course have to go through your doctor or through a provider to get that evaluated and then possibly test again.
Right. Julie, can you talk about kind of the numbers of calls that are coming into that screening line? Sorry, my dog is saying hello too.
No, screening line calls have gone down significantly. We still encourage anyone to call us or email us at rileycountycovid19@gmail.com. Please feel free to email us. Over the weekend, we don't have somebody watching that as closely as they do during the weekdays. So just have some patience with us. We will get back to you. But during the weekdays, we do have individual staff that are managing that email every day from 8 to 5. And so they're pretty quick about getting back to you.
Okay, do any of you have any final thoughts as we move into the weekend?
Vivian, you asked earlier about self-care if you do test positive, and this can be for people who test positive or even just for other individuals. I think that it's very important to make sure that you stay hydrated, make sure that you're eating healthy, that you're exercising. Even during this time of quarantine, we need to make sure that we're taking care of ourselves.
You know, that does bring up a good point there. Research is coming out that there's a high morbidity rate for people who have some underlying conditions that they maybe didn't know about before. So folks with high blood pressure or who are overweight, it seems like they're responding, having a more severe response to the illness. Do you want to talk about that a little bit?
Yeah, so Bob Koppel was on yesterday and noted that the individuals who are hospitalized, about 12% of the individuals who test positive are hospitalized. And from those, we're seeing about half of them that have hypertension, or 48% of them that are overweight or obese. So there are some other conditions that could lead to that. So we just want to make sure, again, to stay healthy and keep that immune system strong.
Okay, well, thank you all so much for joining us today. We are going to be taking a break from broadcasts over the weekend, so unless there's a big development on Saturday or Sunday, we will not be broadcasting, but we will be back again Monday at 4:15. Okay, thank you so much.